Hello. Um, so my hair just happened to be like this out of the shower, so I decided to leave it this way. I can't wait for it to grow back. Yes, I'm doing my mini update. I can't wait to get my hair back. I'm so upset. I still wear a hat outside the house. Um, I want my hair back. I'm sorry, I will never go to Walmart again for a haircut. Um, Excuse me, something happened here. Okay, so, it's the middle of the night. I can't sleep because um, I have intrusive thoughts, which is something I get with hypomania, and then it progresses. It's the same thing, just more intrusive, and takes up more brain space and time if I go into manic. Um, so, and I'm pretty sure I have talked about this before, intrusive thoughts, but I'm going to talk about it again because that's what I'm going through right now. Um, and it's, I, I have to laugh about it, and I'll tell you why at the end. It's one of those things that's not funny, but you gotta laugh at it. Okay? Um, so to eliminate a couple other things, trying to define uh, intrusive thoughts, there are few things that intrusive thoughts are not. And ruminating, yes, I have notes. Um, it's late. Ruminating and ruminations um, are thoughts, they're worries. Um, Things you're worried are going to happen or are happening. You just don't know. And there's nothing you can do to know. And you can't, and it's hard to focus and it's hard to do stuff. But maybe if you get up and move around, clean the house or something, get your mind off of it. Um, a lot of people get rumination, uh, negative thoughts, depressive thoughts when they're in a depressive mood. Um, I do. I don't as much as I used to. It used to be a very big prevalent um, issue during depressions, um, but the cognitive behavioral therapy helped me with a lot of that. Magical thinking, fortune telling, mind reading. So I can't do any of that. So it's easier for me to let it go. But the fact that you're in a depressive episode and rumination or ruminating thoughts are present, then it's can be very difficult to get rid of them because they exist because of a physical disorder in your brain. But like I said, possibly for others, cognitive behavioral therapy can help ease that, and that's when I use that the most. It's the night before, say I'm got a new client, the paperwork they've sent me back sounds like it's going to be a difficult situation, and um, at about 4 p.m. the day before, I start ruminating. Um, and it usually is like over and over. You don't know what you're doing. You're gonna mess this up. These people are gonna think you're nuts, you know. Um, and I can go to the cognitive behavioral therapy tools, and that does help a lot. I have no that tends to put a stopper in ruminating thoughts. I have no way of knowing how this is going to go, so why worry about it now? I just know I can put my best foot forward. I know what I'm talking about. I know what I'm doing, so I have no control over how they're going to perceive me, as far because it's going to be on their end, because I know I'm doing the right thing. So, and all of that is from therapy, like a long time of therapy. Whereas before, that was just my constant. You're a loser, you're fat, you're ugly, you're going to be alone forever, you ruined everything, life sucks, you know, and just over and over and over. And that's ruminating. So that is not intrusive thoughts, although it can disrupt your sleep ability to fall asleep. A lot of times that's when people put their head to the pillow and and then the wheels start turning. Um, and make sure I racing thoughts are different, and that's goes with hypomania and mania. And usually when you're hypomanic and your thoughts are going really fast, racing thoughts, and usually the speech goes with it. Your speech is pressured and gets more rapid as well, trying to keep up with all these. It's like really what's happening is your brain is on steroids, and it's pumping out idea after idea, um, just fabulous stuff left and right, and you're trying to keep up with it. But in hypomania, all of that rapid thoughts, um, they make sense, and you can get a lot of stuff done in that place, especially creatively. Um, I tend to only be very creative. I can be inventive and innovative, but when you talk about creative, I have to be at least in hypomanic state. And thoughts, racing thoughts with manic, that's when you may or may not start to have, well, disorganized thinking. And so what used to come out of your mouth and come into your head and out of your mouth made sense. It was just going really fast. With mania, it's starting to not make, it's not really connecting, and it's not making any sense, and that's what's coming out of your mouth. But it's just, they're just, the ideas are coming, they're just coming from left field. They're just like, um, well, to put it bluntly, crazy, rapid thoughts, um, racing thoughts, sorry. Um, and so, and to sum it all up, if you get to that point of mania, everything is complete chaos and nonsense. But you think you're fabulous. And everything you do turns, everything you touch turns to gold. Everything you do is fabulous and fantastic and wonderful. And really, you're just, uh, if only if only you could keep your mouth shut when you're in those episodes, in the manic episode. If you could just like keep your mouth shut, keep yourself out of trouble. Um, so racing thoughts are not um, intrusive thoughts. Um, but okay, so put a little sticky note on hypomania, okay, and thoughts. Put a little post-it note there because we're coming back to that. Impulsive, intruding thoughts. I keep saying impulsive thoughts. Intruding thoughts are thoughts that pop into your head, typically a visualization of something that is not something you're worried is going to happen. It's a vision. And, and okay, it's not funny, but but the damn things just keep pop, pop, like popcorn. And it's like you're in the middle of a sentence and then you have this vision. And well, we have that all day. The problem is these thoughts are typically, first of all, things you would never do. I mean, well, there's always a possibility, but they're highly unlikely that you're going to do these things. And you find having these thoughts to be very disturbing and guilty and feel dirty and unclean is more accurate. Um, when I didn't know what they were it was very, very scary and I couldn't stop it. And here's where like psychiatric disorders can collide. Um, I was originally, well, when I was 15, I was diagnosed with depression. But up in my 20s, when I first started seeking help for this problem I was having, meaning these thoughts would not stop, and they were triggered by things, and I couldn't get things done. I couldn't keep a train of thought. I couldn't fall asleep. And I had no idea what was driving these thoughts. And so I was originally diagnosed with OCD, which there is OCD about people who have thoughts, bad thoughts, but they're afraid they're going to act on them. Now, there is a difference, though, to what I was experiencing. And they would ask me these questions. I'm like, I'm not going to answer these questions. This is like, these thoughts are like crazy. I'm not going to tell you no. It was like pulling teeth. They couldn't get information out of me. Because who wants to walk around telling anybody this kind of, oh yeah, I entertain these thoughts because eventually, see what, usually they are like images. No, for me, it starts out as snapshots, you know, snapshots. And then as things progress, I will have all out middle and mind in the middle of nowhere 10-20 minute entertainments like I'm watching a movie. And they were really confused because I'm like, no, I'm not in these thoughts at all. I am not thinking that, like for some people, intrusive thought, something, an example might be that when they have conversations with people, they see themselves stabbing them in the head with a uh, letter opener. Okay, that's an example. Highly unlikely it's going to happen, but you're trying to talk and this keeps flashing in your head, blood's everywhere, and you know, and and you worry, am I really the kind of person that could just randomly kill somebody out of nowhere? Is there, what's wrong with me? I can't tell anyone about this. I keep picturing myself murdering my mother. I love my mother. Um, or I mean, like having unnatural sex, or I mean, it's just all the taboo things, or um, illegal, or I'm gonna rob this bank. Um, but it's like you see it robbing the bank, like snapshots, and then later maybe a whole movie. And violent, sexual, illegal, those are the typical. And it's really hard to hold a conversation, to get anything done, if these very disturbing thoughts are going. And the more you resist, the harder they come. The harder they hit you. And it just, and so they kept asking me, they had the wrong diagnosis. So they were asking questions and they're like going, I'm like, no, I'm not in the thoughts. I'm not taking part in the thoughts. And there is a trigger, and it's other people. Okay? So it's nothing I'm doing. So that, if it were something I was afraid I was going to do or pictured myself doing, then I would lean more towards OCD. But what happens is I only get intrusive thoughts when I'm hypomanic and moving into mania. And they could, like I said, they can come out, go from snapshots to movies if I get high enough. Um, it just like I've been doing this for um, I've had intrusive thoughts of this nature since I was a teenager, and I'm older than I look. So we're talking, I possibly could have been having 35 years to 40, 35 probably. Um, about 15 years old. And yeah, I'd say that's about accurate. And 15, and I'm 50. So that's 35 years. So I know the pattern. I know it's never going to happen. That's why I can kind of laugh at it a little bit, but But damn, does it get annoying. I'm not upset anymore about the content. And I tell that to doctors and therapists because I had a therapist that bugged me about the content of the intrusive thoughts. And I could tell that he was getting off on them. And it was just seemed really creepy. And I stopped going there. Um, and so I just tell mental health providers that yes, I am experiencing intrusive thoughts. They are unpleasant, um, and they usually coincide with, where I'm at on my mood scale. And you don't need to know what they're about. Um, it, I'm not fantasizing about killing anybody or committing any crimes. Um, but you don't need to know the content. You just need to know that they exist. And it is the exact same thing, 35 years. The subject is different, but they're always very similar. And it just like can come out of the freaking blue. Watching TV, just happened to be watching the wrong TV show, and somebody moves a certain way or looks a certain way. Even a character in a book, I've had more than one instances of it. The trigger being a character in a book, in a movie, in a TV show, and in the images, it doesn't bother me that they're what is there anymore because it has nothing to do. They have nothing to do with me and my life, and I just what bothers me is I can't do anything else. I can't get shit done because I'll be just like in a groove, typing an email, and then it starts popping. And right now I'm at the poppin' stage, snapshots. And I was like, well, depending on where my mood goes, if it fizzles out, so will the intrusive thoughts. If it escalates, then it's going to become more difficult for me to pay attention. Now, that's going to be to express myself and stay on track and concentrate and focus, which could prove to be an issue if you work. So I'm like, please do not be going there. It one time, the worst one I ever had. Oh, I did not sleep for 2 weeks straight. I was manic, duh. Um, and and I'm not exaggerating. And that's not a falsehood. I did not sleep for 2 weeks. I was so high because I was being prescribed the medication wrong. They had me on this high dose of Zoloft. It was stupid. This is way in the beginning. I just walked the streets middle of the night in my pajamas and just this and and then I thought to myself, I've got to be an evil person to think these thoughts. I've got to be an evil, horrible person that doesn't deserve to be on this earth. Who thinks these things for no reason? Who does that? I'm an awful person, and it took so long to get over that. And now I don't feel any. I understand what they are. My hair's falling. um, I understand what they are, so they don't have as much a grip on me. But I just freak out every time one starts to present itself. And and I don't want to perpetuate it, or because I don't ever want to go in that one place again um, that I was. There's been so many. It's people. It's a person I work with, or person on the TV, a person in a book. It's always always like that. You might say, well, maybe the perspective of a fly on the wall kind of thing, and things are happening with people. Um, so, but I'm comfortable in being assertive and saying you don't need to know the content. That's, you know, that's for me. So, um, so I'm frustrated right now though because I can't lay down and go to sleep because the these things are flashing. I can't concentrate. I can't rest. I can't I can't play Diablo. I can't read Harry Potter. I can't do my Harry Potter puzzle because I can't concentrate. Because these thoughts just keep, they want more. They want me to entertain them more and grow. I'm not kidding. That's really what happens. They want to be bigger, bigger, and they want to take up more of my brain space. And they are useless, counterproductive, and I can't watch any TV on my thing because my current object is on there everywhere. So, but here's the weird thing, as if this isn't weird. The weird thing is, hold on. I know for one that the more you resist intrusive thoughts, the more persistent and demanding they become. So, my advice and what has worked for me is to just let them flow. Just don't acknowledge them. Just be like, yeah, I see you over there. I see you over there. Um, it's just has no has nothing to do with me or my life. Um, there was something else I was going to tell you that is weird about um, intrusive thoughts. Uh, no one, remember that nobody else knows you're having them. That was another thing that people are going to know. They're just going to be able to know. So yes, you can be standing there talking to your coworker and have flashing images of you stabbing her in the heart, with your pen. And you can play it off that nothing has happened. You just sort of brush it aside and get on with the rest of your day. But the more you fight the more you resist, the more trouble you're going to have, um, the more attention you feed it, the bigger it gets. And like I said, it can, for me, it turns into like all out, flat out movies. And I was like, I don't want to think that right now. And, um, let's see. There was something else that was weird that I was going to tell you about them, but I can't remember. But I do say that recognize them as symptoms, and they are something you should tell your doctor, your psychiatrist, and therapist that I have these thoughts as not things I would do, but they're bothering me, so I can't focus. But just so they know they're there, because we have gauges, and everybody has their own gauge. You really need to come in tune with your gauge. And the thoughts are mine. I know that the more time I spend on an intrusive thought, the more, um, or the more intrusive it gets, like slamming the door on it and it busts through, and that just keeps happening. Um, then I know that something's gone to another level. And if I find myself through the whole day having all out movies, then um, then I know I've progressed even more, um, into mania. And I've probably started writing some of it down because that's I get it is called hypergraphia, I think. When you write I write on everything, about everything, stuff I think's fabulous. When I'm manic, I get obsessed about what pencil I'm using. It's got to be the right pencil. One time I was in the hospital and they took my pencils away. Okay, so that's what I have to say about intrusive thoughts. I think my medication's kicking in, and possibly I might be able to get some rest. Can you just see what the ravages here of my hair? I never knew I was vain until I got this bad haircut. So, yeah. Um, so that's my piece on intrusive thoughts, is leave you all hanging about what my intrusive thoughts are. Um, they're I'm not in them. Um, just now I remember what I was gonna say, and I just had it, trying to not tell you, and I do a blinky weird thing when when I'm trying to do something, like I'm at work. Well, I don't. I go to people's houses now. When I worked as a nurse, and um, when I was anywhere, people wouldn't understand what I was doing. But I do this sort of head tapping thing. And if you ever see me do head tapping, that means Megan's having intrusive thoughts. Um, I don't know. It um, it sort of helps contain them, interrupt them, so I can focus on something getting done. It's like a grounding type of thing, and it's something I can do that people aren't gonna think is too weird, you know? And but towards like if it gets really bad, I'm like tapping and pacing, and my dog is my service dog is trained to alert to that behavior. So when he sees me like this, he has a barking, jumping, hissy fit to stop me because it it's happening. They're there, and they say intrusive thoughts, and I would be really interested in knowing if people have more than one. See, I have one intrusive thought but the cast is different, and but the subject matter and the activity is the same. Um, Always. So I'm wondering, some people, um, like have intrusive thoughts where I'm gonna run this pedestrian over, and then tomorrow I'm gonna rob the bank intrusive thought. So I would like to know that from anyone else who has, excuse me, intrusive thoughts. Um, it can get complicated because if you tell a health professional I have intrusive thoughts and you say, uh, I just have these thoughts that I'm gonna stab my mom with butcher knife. Well, that wouldn't really be stabbing, would it? But anyway, killing my mom with butcher knife. They have to decide if you're like if you're expressing yourself well enough to say that this is something I would never do, but I can't get it out of my head. Or is this someone who wants to do this and they're holding back? So um, that's why I say content isn't something we're going to talk about. It's embarrassing for me to someone who doesn't know what I'm going through, so they don't need to know. Um, it, it, I used to be so ashamed and so embarrassed, and I'm not anymore. Now I'm just flat out, I'm annoyed. I'm annoyed that I can't just be like normal people and not risk watching a show and that connection happening. I don't watch certain movies because certain people in the movies or the television shows have been objects, subjects, people in the intrusive thoughts, and they were triggered while watching that. So I don't. I can't. I can't watch Moulin Rouge. Um, Howard's End's a little strange. There's it's just strange. Uh, like my one of my favorite shows now suddenly decided to have an intrusive thought stick, and now I can't watch it. So I'm gonna go to bed now. I hope you all are having an intrusive less day or night, whichever I get this posted and up. All right. Good night.